Oftentimes people have needs that are beyond what can be taken care of at home. They require more pain management. Families need a break. There's just situations that you really need that inpatient care, and the hospitals are not the appropriate place for that.
You know, we're in there to do the symptom control and to help with pain management. And we do everything we can to make sure that our patients have good days. We don't limit their days. We just want them to have good days.
My hospice experience started with my son, Michael, who was diagnosed with cancer when he was 23. Michael was the classic older brother of his two little sisters. The hospice gave him control over his life. They care for the person. What do you want to do? How do you want to do this? How do you want, family, how do you want this all to work? What do you think you can handle? What can we handle for you, you know, to help you through this? So he got to die with dignity. I don't know how we would have gotten through it without him. We wouldn't have been able to get through it without him. I will support hospice and promote hospice until I'm probably using hospice.
Unfortunately, we're all going to die, but we do have a choice of how we're going to die.
My mother had a stroke, and the doctors felt that she needed to go into hospice care. I had never had any experience whatsoever with hospice before that time. The moment I walked in the door, I found it to be just peaceful and calm. There was none of the usual hospital noise. It was just a pleasant place to be.
Of all the organizations that I've served and have belonged to in a variety of ways, I think hospice is by far the best. I think it's the best organized, I think it's the best intentioned, and I particularly think as a nonprofit agency, it really is there to serve people and to do the best and to give the best care that they can for people going through the transition from life to death.
Hospice is like a busload of angels show up at your door and they say, we're going to take care of you. And we're not just going to take care of the person who is dying or badly sick. We're going to take care of all of you. Caregivers and everybody. Anybody that's out there that wonders, is this a good place to give my money? Don't worry about it. It is one of the best gifts you can give anybody. You're not just helping a person. You're not just bringing in morphine and an oxygen tank 2 days before somebody dies. You are going to help somebody during the worst days of their life. You're going to lift a load from them, and you're going to enable them to focus on time with their loved one.